Hey guys, Andrew Romano here. Today I'm going to be talking about a topic that is highly relevant for a lot of people out there that are trying to fall pregnant. The condition is called Poly-Cystic Ovarian Syndrome, or PCOS. Now, to give you some insight into what PCOS is, let's first of all talk about how PCOS affects women and what are the steps necessary in order to actually diagnose Polycystic Ovarian Syndrome. PCOS is when a woman of reproductive age fails to ovulate. This is due to a hormonal imbalance, and it can either be that these women are predisposed to it through genetic factors, or it could also be that their lifestyle is contributing to it. Lifestyle factors could include things like high levels of stress and anxiety, sleep quality is poor, and physical exercise regime isn't quite happening, poor diet and weight gain, or even things like medications and environmental toxins. Now, when it comes to diagnosing PCOS, interestingly, up to a third of women that have polycystic ovaries seen on an ultrasound don't actually have polycystic ovarian syndrome. You see, in order for PCOS to be diagnosed, 2 out of 3 aspects need to be confirmed. Number 1, there's an absent or irregular menstrual cycle. Number 2 is that there are signs and symptoms of increased male hormones in the body. Those signs and symptoms might include acne, excessive bodily hair, increased weight, and even a reduction in scalp hair. And number 3, of course, is that on an ultrasound, polycystic ovaries are seen. Now, if a woman is diagnosed with PCOS, typically they'll suffer from a range of symptoms. They might include things like absent or irregular menstrual cycle, mood changes, including anxiety and depression, acne, excessive facial or body hair, scalp hair loss, weight gain, sleep apnea, and of course, reduced fertility outcomes. In fact, did you know that PCOS is the single most common cause of infertility? It's involved in up to 40% of cases of infertility. Don't be discouraged by that though. Scientific research is constantly developing with protocols to improve fertility outcomes for people with PCOS. Important for my team though, we're really amazed about the amount of scientific research out there supporting how acupuncture can help improve fertility outcomes for PCOS. According to current studies, acupuncture has been shown to decrease the excessive hormones and promote a healthy menstrual cycle in women that are suffering from PCOS. Acupuncture literally disrupts that hormonal imbalance and stimulates a healthy menstrual cycle, which is necessary for fertility outcomes. Now, as for how we can help produce these outcomes, acupuncture has been shown to help promote the recovery of PCOS by regulating the release of female reproductive hormones that are normally produced by a healthy menstrual cycle. Given this, I'm really glad to be able to say that the natural treatment options that we use at Evolution can be used to stimulate the recovery of a healthy menstrual cycle in women with PCOS. By doing this, we can help positively impact fertility outcomes. So if you've been suffering from PCOS, reach out to your healthcare professional. They'll be able to assess your situation, give appropriate lifestyle and treatment advice to get you back on track. If you have any questions, as always guys, reach out. My team will be glad to help. Talk soon.